Hi everyone. So we are live. It's Monday evening. We just finished our the legislator just finished its session for Monday, and I wanted to take a moment just to check in on everyone, see how you're all doing, and also spend some time answer your questions. We actually debated the budget bill today, Bill 229, and over the weekend we actually had a lot of questions, a lot of emails, messages that came in from many of you across Scarborough Southwest. So I wanted to just take a moment to address some of those and talk about this bill and what took place in the House today. So as you know, we are this is actually the last week in the legislature before we're back in the riding, and this bill that the government is trying to pass through has been, this was the third reading, which means this is the final reading of the bill, and the vote will take place tomorrow. And just this past week, we've had on Wednesday, I believe, Wednesday and Thursday, we had the government just introduce about 96 pages of, or 98 pages of amendments, and then just gave about a day for folks to go through these amendments. And then on Friday, that was it when it came to voting on those amendments. And then it was back to the legislature today for third reading. And now they have closed the debate, which means that the vote has been called. And tomorrow around noon, we'll be voting on that bill. So before actually I get into the bill, I wanted to say that if you have any questions, if you have any concerns about the bill or anything else in Scarborough, anything else that you're concerned about, as your MPP, always here to help and answer your question. And you can also reach out to us via email or give us a ring. We're doing everything possible to make sure that we can respond to you as timely as possible, and we're here to support local people as much as we can. So this budget bill, which actually they called it to protect, recover, and what was it? Protect, support, and recover. And it's really interesting that the government has called it that, because today I've listened to government members talk about this, and it was interesting because we were looking at some of the numbers of where we are today as we address the second wave, and our riding and the city is under a lockdown now. So we have about, let me just go through some of the numbers of where we are at this moment. We are right now, we have 1,925 new COVID cases that have been reported today. 26 people have died since yesterday. We have 11.7% positivity rate in some parts of our riding. So around Eglinton East, for example, if you look at Scarborough Village, we also have about 9.7% positivity rate, which is actually really high. It's higher than many parts of the province. We also have 138 school-related cases, and in total, about over 5,000 school-related cumulative cases since the beginning of the pandemic. And one of the figures that I wanted to share with you that actually made me really concerned is that 725 people have been hospitalized, and about 213 of them are now in ICU. And although there has been expectations or people have anticipated this, the reason I'm really concerned about that is because just recently I had a conversation with the CEO of Scarborough Health Network, and one of the biggest concern that she's highlighted for me, which was, and this is something we knew even before the pandemic when I visited the hospitals, were that the infrastructure of those hospitals, especially the general location in Scarborough, is very old. So that means a lot of, they're just not equipped the same way as other hospitals to address what we're facing right now, which means that, staff are working extra hard, our healthcare workers are working extra hard to make sure that they prevent the spread of the virus. But the actual infrastructure of our hospitals are not made in such a way that it helps them. People who are going through the doors for COVID are also going through using the same path for non-emergency visits as well. And right now they're really getting to their capacity when it comes to non-COVID related emergencies. And obviously, like many other hospitals, they have stopped taking in non-emergency cases, surgeries, etc. So it's a very difficult condition for Scarborough and people who live in Scarborough Southwest and across Scarborough. And this is why it's concerning when we see such high numbers in ICU, because it's that moment you start to think about the difficulty that we have, that capacity of our healthcare system and how overwhelmed they are, and how, what ability they have to continue doing what they're doing to protect all of us. Now, despite months of warnings and calls from public health officials, doctors, nurses, we've had all healthcare workers really called on the government for this. We actually, after all these months, we finally had this bill, which is called the budget bill, which is the Bill 229. And what I want to do is just break down the bill into some aspects about healthcare, some things about education, and a little bit about something else that has been really, really important. And recently we heard from many of you, which is about the environment and what this bill does for the environment. So first, touching on healthcare, we know that what we're facing in our healthcare system, people have called on to really recognize the desperate need in our healthcare system. And in this budget, it makes a claim that they're spending about $15.2 billion. And first of all, about half of that is actually contingency money, so they're not actually spending that. But the other part of that is, does that actually help people in Scarborough, or the conditions that we just talked about for Scarborough hospitals? People are already delaying or canceling their surgeries because they don't get well, and hospitals are. And when we look at the conditions, the community and the lack of testing in Scarborough, when we talk about the need to help community organizations, when we talk about mental health support, there's a huge gap when it comes to the services that are necessary for Scarborough. And this budget really lacks in providing the amount of support that we need for people across Scarborough. The budget also doesn't really look into the human resource strategy. And this is something that we have had many people call on the government for. The Ontario Hospital Association talked about the gaps in staffing level, for example. We know in Scarborough, we've had many healthcare workers come forward and actually call on our offices. And I'm sure many of your family members who are healthcare workers know about this as well. So what we have had so far is some one-time funding or some support in terms of having a little bit more of. Recently, we now have a testing center in Oak Ridge Community Center, for example. So some small changes that we are really pushing for, but they're not enough. After calling on a lot of support, we get very tiny amount, and it's really frustrating when that happens, because that always seems to be the case when it comes to Scarborough, when it comes to the need of people across our communities who work as hard or more, actually even harder than I think anyone else, who pay their dues. But when it comes to getting a fair share of the provincial funding, we always get the short end of the stick. And I have called on the government members who are, in other parts of Scarborough ridings to really look into this, because this not only impacts right now, but it has long-term effects. And the results in our hospital, for example, is one of those results from the lack of funding for many, many years. We almost a decade of neglect in our hospitals have resulted in the type of infrastructure that we have right now in our Scarborough hospitals. When we look at the piling up of non-COVID related what medical needs, for example, that will be really difficult for our healthcare system in Scarborough to really hold up, and that will be extremely challenging. I also want to talk a little bit about the something that actually comes up all the time, which is, we're talking about a time when people are asked to stay home, and for any government, anyone, it's easier for us to say stay home, but the outcome of that, there's many implications of that. But one of them is the impact on our mental health, impact on addictions. And this pandemic has had an adverse impact on the government, on mental health for Ontarians, and the lack of support that we have for Ontarians when it comes to the mental health needs. And in Budget 229, or Bill 229, has no real spending on mental health support. It's got the same amount of funding as they do on a yearly basis when it comes to addressing mental health. And it didn't really take into consideration what else do we need to do to help people who are stuck at home. We've got a lot of seniors who are stuck alone, whether it's at home or in long-term care setting. We also have a lot of women, for example, who are I have talked to, who are in abusive relationships, who are stuck home. There is also a lot of youth who are going through, who need support and have called on for support, but have been struggling right now. And the wait time is over 2 years. The recent data shows that it's about 2.5 years wait time for getting mental health support, which is extremely concerning. And while I touched on the long-term care piece, I also want to talk a little bit about this budget and what it does for long-term care. In March, we had the fiscal update, which actually had an investment of $4.63 billion. And this budget, we saw that the government has changed that figure to $4.53 billion. And this is only an allocation. So not only have they not spent this money, the other dangerous part of it is even when they're playing around with numbers, they're decreasing the numbers. And after what we saw in long-term care, it is extremely concerning to see what's happening, because it's just the amount of deaths. We have had over 2,300 deaths in long-term care. We've had over almost about 10,000. Let me just give you the exact number. We've had 8,966 long-term care resident cases. We've had many workers in long-term care who have also had COVID-19 from just working in care settings. And I've all of today, we have had to hear government members talk about how much they're doing for frontline workers. And the reality is we have lost over 3,000 frontline workers who work in long-term care homes. Over 3,000 long-term care workers have died. And the fact that so many essential workers, so many healthcare workers, so many frontline workers have caught the virus, and what it's done to their families. There's first we have to appreciate the work that they have been doing, but also along with the appreciation, along with calling them heroes, we have to make sure that we provide them with the support they need. We provide them with the pay and the benefits they need as well. These people are putting their lives in doing the jobs and making sure that they're protecting us. And another group of people that's actually out there right now is educators. And I want to touch a little bit about educators and the work that they've been doing. When I looked at this budget, I had a lot of expectations because we know the cases that have been we've had over 4,000 school-related cases, 2,000 of them being students, and we needed to do something about making sure that kids and educators are safe in our schools. And today I heard the government just repeat that they're spending $1.3 billion for education, and yet the numbers don't add up because they're just playing with reserve funding and claiming that they're actually spending that. So the funding that's actually been there before from the federal government is now being claimed by the provincial government. So here we are being played by governments where real investment in schools are not taking place. And really the people who or the ones who lose in this are the people, are the students, our kids, and the educators. And while we really there's a lot of pieces that are missing on this budget. One of the things that they actually talked about, or this budget does, is makes an attack on environment. And this is the one piece that I want to highlight tonight. And the reason I wanted to just come on here live and talk to you, because it is just in sort of this under the name of COVID response, we had the government just outright attack the environment. And many of you have reached out to our office regarding this. And this afternoon, I was able to submit the petition that you have signed. And I want to thank you all who have signed the petition and sent your messages, because I was able to share some of your concerns and hand in the petition to the clerk so that it will go to the ministry. While we're facing this existential crisis of the biggest public health crisis of our lifetime, we're actually also facing the threat of climate change, and it's so real. And I had really hoped that during this crisis, the way we have addressed many of our challenges, the way people have come together and changed their behaviors, and how we're really rethinking, reimagining our lifestyles. You would think that we actually make changes that actually addresses climate change, but this budget, the Bill 2029, it actually has massive changes that makes it even worse for the environment. And it is so problematic because Schedule 6, which is something that I'm sure you've all heard about, Schedule 6 in this bill is, it actually takes away the power from conservation authorities and gives the minister the power to just hand out permits to his developer friends. And what it does is it takes away, we have had conservation authorities for 80 years who have been protecting our, rivers, lakes, endangered species. Conservation authorities have also been protecting the wetlands across the province and making sure that they're helping with preventing flooding. So the way that it will actually, not only will this weaken the role of our conservation authorities, it actually puts all Ontario at risk. And for what? Just to give benefits to big developers that are the friends of this government. And it is just shameful, and I just cannot believe they would do this in the guise of pandemic relief in the budget bill, when you would expect the government to actually help people. So I just wanted to take a moment and talk about that, because it was a very sneaky move, and we've had people across the province call the government out on this. We've had many environmental organizations who have called the government out on this. But also over the weekend, we saw that the chair of Greenbelt and former mayor of Toronto, David Crombie, actually resigned because he was upset, and I think what he called it is the bombing of what did he call it? It was the bombing of our conservation authorities. And actually, I'm going to pull out the exact wording that he had. But it really it's so harmful, and we've had conservative, and this is someone who's actually was a conservative minister as well, and we've had people who have time and time again called on this government to do better for the environment, and here we are. Not only are they not protecting the environment, but they're actually making it worse, and making it easy for developers to just pave through wetlands and make it easier for developers to do things like that. And let me see. Oh, and actually, along with that, it's not just David Crombie who resigned. 6 others resigned during the weekend as well, from the council. Let me see if I could find the exact wording of this. Let me see. Oh, I want to thank all of you who joined in as well. Let me see if I could pull this down so I can answer some of the questions you have. We have one comment here about Indigenous child welfare agencies are not adhering to Bill C-92's national standard. The overrepresentation of Indigenous children in the foster group and residential custody placement is at a higher rate in comparison to the highest attendance in residential schools. Do you commit to addressing the systemic racism Indigenous children and families face, and the fact Indigenous child welfare agencies such as Native Child and families are in non-compliance of Bill C-30? So actually, so this afternoon, I actually had my colleague Sol Mamakwa who spoke about what's happening in some of the communities. And since I'm speaking about Bill 229, one of the things that this bill is really missing is that it does not have anything to help Indigenous communities. And it misses the point when it comes to providing a support for Indigenous communities, providing clean drinking water. There is no support in terms of really protecting Indigenous communities during this time of COVID-19. And in terms of the foster care system, residential, I mean, the fact that the bill doesn't even have anything to address any of that is extremely problematic. And we have to make sure that we are actually, if we're actually going to address some of the issues with Indigenous children, one of the first things that we have to do is to make sure that they have living arrangements that's safe. And the other part is mental health support. So all the agencies, for example, all of the support system that we have, they need to be able to do the job right, and the service providers, and making sure that we have and actually Scarborough Southwest has the highest amount of Indigenous people living in Scarborough Southwest in the city, and there is in the lack of support system that we have, our agencies supporting the community is very, very small, and that really I think shows what our problem is. I think and I agree that there is systemic racism when it comes to addressing some of the challenges that children and families face. 100%. I think there is a lot more we have to do when it comes to addressing, well, first admitting that there is a problem, and then providing the support and really committing to that means that making investments. I've seen my colleague from Quitnam talk about some of these issues in the House over and over and over again. There are times when he's addressed challenges about a community and talked about what they needed. A week later, he reported in the House about how one of the kids in the community committed suicide, and the fact that months have gone by and the government has done nothing to address that. It means that we need systemic change. It means that we need to be able to have a government that actually understands the problem, admits that there is a problem, and has a budget that actually has funding for communities like this. And obviously, going back to the environmental piece, a lot of communities live in these protected communities, which will be, that protection will be gone from Schedule 6. And that is a huge problem. The government always talks about red tape reduction, and what they do is they basically make it, whenever they talk about removing red tape, they talk about removing protection that helps, protection like environmental protection. I had quite a few other people who actually reached out that I wanted to say thank you to. Someone actually wrote to me and said, nature provides essential services to fight these crises, and there are clear paths forward for green recovery from the economic impacts of COVID-19. However, your ministries are instead adding fuel to the fires of all these crises by evading and undermining existing environmental protection measures. Absolutely, absolutely. This is what they're doing. In the middle of a pandemic, we have the government, instead of helping, reduce carbon emission, instead of actually reaching our goals of reducing our carbon emissions, we have the government making it even easier for developers to pave through some of our protected lands, and that is extremely problematic. So I wanted to give you sort of an oversight of what's happening with healthcare, education, and environment, and kind of just check in and tell you how it's been with this bill. And tomorrow, I hope you'll tune in. Well, you can check in terms of the vote that takes place. So around noon, we'll be voting on Bill 229, and I will be voting against this bill. I do not agree with Schedule 6 and Schedule 8 and Schedule 12 and quite a few other schedules that are very, very problematic in this bill. But also, I just wanted to say that I'm listening to you, and I'm thankful to all of you who have reached out and shared your opinions. And we'll make sure that throughout today and over the past few days, we've made sure that your concerns are sent to the government. We made sure that we spoke in the House about your concerns, and we will be voting against this bill because we're with you. We do not agree on these measures that the government has taken on. So on that note, I want to say thank you to all of you who have joined today, and I'll call it a night. And join me next time when I do another live and talk to you about some of the things that takes place in the legislature. And as always, reach out to our office if you need any support and have any concerns. We're here to help. Good night, everyone.